Welcome, everyone. We're excited to welcome Suzanne Gordon to present to the Healthcare Now Strategy Conference of 2024. Suzanne is an award-winning journalist and author who writes about healthcare delivery, healthcare systems, patient safety, and nursing. She is the co-founder of and a senior policy analyst at the Veterans Healthcare Policy Institute. Her latest book, Our Veterans, Winners, Losers, Friends, and Enemies on the New Terrain of Veterans Affairs, was published by Duke University Press in August of 2022. So now I will turn it over to Suzanne. Thank you.
Hi, thank you so much for having me. I'm very excited to be at this conference. I've presented at past ones and it's very excited to be at this one. Talk to you about why we should fight for VA for all and against VA privatization. And what I mean by that is that a lot of folks in the audience are involved in the struggle for Medicare for all. And while I very much value that struggle and slogan, Medicare is a payment system only, and it's not a delivery system. And there's equal parts wrong with our healthcare system in terms of the payment system as an insurance payment system, for profit system, et cetera. But there's also equal problems with delivery. And you can't really change the delivery system as easily if you're just the payer as opposed to the provider of care. National health systems in other countries are generally, except for Canada and some other ones, the payers and providers of care. So the national health system in the UK. So the national health system in Great Britain, Scandinavian health systems, many health systems in the world are not only payers of care, but providers of care. And if you're both a payer and provider of care, you can more easily change how care is delivered and address problems in the delivery of healthcare. And you can also deliver healthcare as opposed to only medical treatment. And we have a system in the United States that's a model for that. It's both a payer and a provider of care, and it's called the Veterans Health Administration, which is the healthcare system run by the Department of Veterans Affairs, which is the second largest federal agency in the US government. And I think that system, after having written about it and researched it for over 15 years, is undisputably the best healthcare system in the United States. And it study after study after study shows that when it's compared, VA care is compared to the private sector, it's better in everything from mental health care to cancer care to diabetes management, chronic condition management, mental health care. And then it provides a range of services that addresses social determinants of health, like employment, housing, legal problems, and so forth. So it's really not only, in my view, it is really not only the largest healthcare system in the country, which it is, it's the only national system in the country. And it's also the only publicly funded and integrated healthcare system in the country. And I'll explain what I mean by integrated in a minute. And it's able to deliver not just medical treatment in a coordinated and integrated fashion, but also to address issues like social determinants of health, issues of population health. It's, I would argue, the only healthcare system in the country that actually doesn't just talk about health equity and set up, commissions and committees, but actually delivers on that rhetoric. It walks the walk as well as talks the talk. And so I think that in our discussions about what we are fighting for as healthcare reform activists, I would advocate that we fight for something resembling VA for all. And I think it's important to talk about what that means, VA for all. We should definitely be fighting against VA privatization, because if we can't stop the privatization of the largest healthcare system in the country, one that has a very special constituency and a very organized set of advocacy groups, then I think it's very hard to imagine that we could ever accomplish any serious efforts at healthcare reform. And I always talk to my friends in the Medicare for All movement and say, like, in case you hadn't noticed, we're not getting Medicare for All. The bills are going nowhere. Sometimes their sponsors won't even talk to us. And since we're fighting a long-term fight, I think what we should really be fighting for is a national health system, which is both a payer and a provider of care. And we don't have to look to Canada or the UK or France or any of the OECD countries that have national health systems. We can look at our own country and look at the health system that we've invested in for the past 70 years, which sadly only covers a small percentage of Americans. It's about 19 million veterans, and only about 9 to 11 million of those 19 million are eligible for VA care. So what I'd like to do is kind of talk to folks about the VA and what the healthcare system looks like, because I think that many people listening, many may know about the VA healthcare system, but a lot of folks don't. So let me just start with the Department of Veterans Affairs, which is called the VA. A lot of people refer to it as the Veterans Administration. There's no such thing as the Veterans Administration. The Veterans Administration existed from 1930 to 1989. Reagan made the VA, the Veterans Administration, a department of the federal government, a cabinet level department in 1989, and it's now called the Department of Veterans Affairs. If it was like the Department of Justice, or the DOD, the Department of Defense, it really should be the DOVA, but it's the VA for short. So if you're talking to vets or talking to policymakers, don't refer to it as the Veterans Administration. That no longer exists. Just a little helpful hint. So the Department of Veterans Affairs, the VA, runs 3 sub-agencies: the Veterans Benefits Administration, which is the largest benefits processing enterprise and administration enterprise in the United States. And they administer the GI Bill, which is the free education to qualified military veterans. And they administer home loans and compensation for military-related problems, et cetera. And then there's the National Cemetery Administration, which buries qualified veterans. And then there's the VHA, the Veterans Health Administration, which is the largest publicly financed, fully integrated healthcare system in the United States. And that has about over 300,000 employees. A third of them are actually veterans. And they have over 1,200 sites of care, 170 medical centers. They're affiliated with academic institutions in every place that they have a large medical center. And so they have academic affiliations. And they have, the VHA has 4 primary missions. Its first mission is to deliver clinical care to veterans. And in the process of doing that, it has developed models of care that are really very innovative and different from the kind of care that folks who are non-veterans get in the fragmented American broken medical treatment system. And I'm going to harp on this difference between medical treatment and healthcare, because medical treatment is part of healthcare, but definitely not all of healthcare. And we don't even do the part of healthcare that's medical treatment well in this country. But we don't really have a healthcare system in the sense of a system that delivers not just medical treatment, but mental health care, addresses issues around the social determinants of health, cares about health equity and population health. And the VA does all that. The VA, you have to imagine the VA as a population health system that addresses the problems, the very specific problems of military veterans. And because we have this vast imperial army and we wage a lot of wars, many of them elective and, in my view, unnecessary, we have a very large veteran population, and they have very specific problems. They have more neck, back, skeletal issue problems than ordinary people in the same age cohort. They have toxic exposure problems, Agent Orange from Vietnam, which has produced all kinds of conditions that are very specific to these veterans. Burn pit related problems for the post 9/11 vets, where they were, if they were in combat in the Middle East or Afghanistan, they were breathing in these toxic fumes of literally everything that you can imagine was burnt in these burn pits. It's extraordinary. I mean, the military is a very reckless employer when it comes to safety. And the burn pits, they chose a 15th century way to dispose of 21st century garbage, which is burn it, and around the people smelling in. So we have all these people who were in combat and non-combat roles on these bases, just breathing in this stuff 24/7, and they have all kinds of problems. That 50% of veterans have mental health problems, often related to PTSD. They have military sexual trauma. Many women, 1 in 4 military veterans who are women, but also men experience military sexual trauma, which is everything from, harassment to rape, and murder. Obviously, if you were murdered, like Vanessa Gillen, you didn't have military sexual trauma as a veteran because you are dead. But many women have had terrible experiences with military sexual trauma. Most people outside of the military don't even know what that is. Most psychologists don't even know what it is. And so there's all kinds of problems, traumatic brain injury. And you don't, what's very interesting is you don't even have to have left the continental United States to suffer from these problems. I mean, women, PTSD can be a result of seeing friends blown up in combat, or blowing kids up, in combat. Or it can be the result of brutal training regimens in the continental United States. You can get traumatic brain injury from, an IED, an improvised explosive device, in the streets of Iraq, or you can get one from shooting too many mortars or grenades in the US. And, the person who was responsible for the mass shooting in Maine, I believe he was a grenade instructor, and he just, over a lifetime, these exploding grenades, like, they're not good for your brain, and they ended up frying his brain in ways that led him to be homicidal or suicidal. So musculoskeletal problems impact veterans who've never been in combat, because carrying 100-pound packs when you're running and doing all kinds of extreme exercise is not good for your body, and so forth. So the veterans have very specific problems. They tend to be chronic problems that the VA is very expert in dealing with, and they've developed models of care for this population, which is older, sicker, and poorer than most populations in America, because you cannot get eligibility for VA care, VHA care, unless you have the right discharge status, and a proven military related disability, and or you are low income. So the VA, unlike other healthcare systems, which cherry pick healthier and wealthier folks, the VA deliberately cherry picks people who are poorer, sicker, and older. And it delivers care, clinical care to them that is better than the private sector and at lower cost, which is amazing. So this is another reason why I say VA for all, because it's a model of care, delivering care to the most complicated, sickest, oldest, poorest patients in the nation. And it does it better than the private sector. It delivers better health outcomes than the private sector does to richer, more affluent patients who are younger. So it's really a model, it's something that we really need to look at, because if they can do it, if they can deliver this kind of stunningly integrated and excellent care to a population that is very complex in ways that are different from the average person that is seen in the private sector, then imagine, and at lower cost, imagine what could be delivered to people who are not as complex, not as sick, and younger. I mean, the average patient over 65 who presents themselves in a doctor's office outside of the VA has 3 to 5 presenting problems. The average Vietnam vet has 9 to 12. My friend who's an Iraq vet who's 32 has 16 different presenting problems. My kids who are 35 have like 3, most of it related to too much computer use, not, carrying 100-pound packs on their back. So the VA is a very interesting model from which we can learn. It's also a socialized medicine system, a socialized healthcare system, right? Once you're in, you don't pay, and it operates on very different, its clinicians operate on very different, with very different incentives than in the private sector. The other thing the VA does, so its first mission is to provide clinical care to veterans and innovations in clinical care from which we can all learn. Its second mission is and this is an explicit congressionally mandated mission. It is the hub of our healthcare professional training system in the US. It trains 70% of all physicians in training. It has 50% of postdoc psychologist training programs the VA hosts. Nurses, OTs, occupational therapists, physical therapists. It trains 40 different health categories of health professionals. If the VA disappeared, the healthcare training professional system in the United States would collapse, because there would be nowhere for people to train, not only in veteran-specific conditions, but just to have residencies in primary care and psychology and so forth. It also has a third mission, which is research. And again, congressionally mandated. The VA is the second biggest research powerhouse in the United States after the National Institutes of Health. If anybody listening has ever used a nicotine patch, had the first shingles vaccine, an implantable cardiac pacemaker, all of this is thanks to the VA. They do research on prostate cancer. The American Prostate Foundation gave them huge grants and is working with them for years, because they have the biggest collection of prostates from discharge to grave in the country, because it's the military. So until recently, it was almost all men, and so there's a lot of prostates out there. And they can really look at vexing questions like, why do African American men suffer more and do less well under treatment and so forth. So it's a huge research powerhouse. One of the things that's very interesting about the VA is that it researches drug side effects in ways that no other healthcare system can do, because no other healthcare system prescribes the drugs to the patient, pays for the drugs to the patient, so it knows what prescriptions have been refilled, and actually tracks the side effects for patients, so they can answer all kinds of vexing questions about drug side effects and so forth. And the other thing the VA does that very few people know about is it has a fourth mission, which is to serve as a backup to the DoD military health system in times of war and national emergencies and terrorist attacks, and also to serve as a backup to the civilian healthcare system in times of regional, local, and national emergencies. For example, in California, tragically, we always have these wildfires. The VA sets up command posts in their healthcare centers to call patients to find out if they can get to appointments, if they have their medications, if they have their medical equipment, if they're all right. I mean, I've never gotten during a wildfire in California a phone call from my healthcare system trying to find out, hey, how you doing? You know, like really? That fourth mission is very important, and very few people kind of know about it. It has, you know, as I mentioned before, it has a lot of benefits to all of us. It does very well, particularly in things that the American healthcare system doesn't do well in. For example, it's based on a system of team-based primary care. Every primary care clinic in the VA is run with what are called patient-aligned care teams, which include nurses, clerks, licensed practical or vocational nurses, doctors, nurse practitioners, or physician assistants, it primary care is critical to the VA. So where the American primary care system is collapsing and was never really well resourced or funded, VA primary care is very well resourced. It has incredible geriatric care. We have 7,600 geriatricians to take care of something like 33 million people in America over 65. Kaiser in Northern California has one or two, if that, geriatricians to take care of folks after over 65. The VA has practically invented geriatrics, has geriatric primary care clinics. I had a friend who was an 87-year-old vet who got into the VA, and I thought he should go to the primary care clinic, and I know a doc there, and I said, you should go to her, and she said, oh, no, he has to go to the geriatric primary care clinic, not to the regular primary care clinic, because he's 87. He has very different problems, and that's where he went. He went and was seen there, and his wife got a call the next week from some woman, and it would turn out it was his doctor trying to find out how he was doing. I mean, when was the last time one of your doctors called up after an appointment, like, how you doing, Jerry? Or how you doing, Suzanne? You know, that almost never happens, but it happens routinely in the VA. I would argue that the VA has the only functioning mental health system in the country. The mental health system in the US, as you know, is a scandal, and it's primarily prisons and jails. There's home care, there's integrated care. And what do I mean by integrated care? This is a really important concept. American healthcare, or what American medical treatment, we shouldn't really call it a healthcare system, and it isn't even a functioning medical treatment system. But if it's anything, it's a medical treatment system. It's fragmented. You have to be your own care coordinator if you're not in the VA. In the VA, care is coordinated. They not only share the same medical record, but they but care is coordinated. For example, on primary care clinics, every primary care clinic has on-site co-located in the same clinic where it's possible. There's some small clinics that don't have this, but in every larger clinic has a your complement of primary care providers. They could be physicians or nurse practitioners or physician assistants, as well as a psych nurse practitioner or a psychologist on site. So if somebody tells their primary care provider, hey, I feel depressed or I'm anxious or whatever, they don't just write them a referral to a psychiatrist or a psychologist, and which the patient may or may not call for an appointment, and if they call for the appointment, they may not show up. They walk them down the hall in what's called a warm handoff, right then and there, to a psychologist or psychiatric nurse practitioner, who will then talk to them about their problems, and then either handle the problems right there or refer them on within the system to other mental health practitioners. They screen routinely for PTSD, military sexual trauma, suicidal ideation. I mean, my primary care provider, who looks at me as a series of organ systems and lab values, wouldn't even know if I was depressed. I mean, if I were suicidal, and I wouldn't tell her. Right? She's the last person on earth I would tell about anything. And it's just, I mean, you're increasingly in the broader medical treatment system, you're treated as lab values, or, the 15-minute interview, or 10-minute if you're lucky. VA providers have smaller patient panels. They have a routine visit is a half an hour or more, because they have very complex patients and they're not profit driven, right? They're mission driven. It's not churn. So they have mental health care. They have they deal with patients with homelessness. They have a vast homelessness program to deal with unhoused veterans, which they work with the Department of Housing and Urban Development to administer. They have veterans courts and veterans legal programs for veterans who have legal problems. They deal with unemployment. They deal with vocational rehabilitation. So if people have PTSD, this is an example. And a sheriff who was in Hawaii, who I interviewed, had PTSD. He went into residential programs a couple times, but he was being triggered by his job, right? Because he was a sheriff, he was in law enforcement, and he was told, if you don't get out of law enforcement, you're gonna have this problem very severely forever. And they put him through vocational rehab, and taught him to be a blacksmith. And he isn't a sheriff anymore, and he's like a whole lot better. So they have integration, and they have way fewer healthcare disparities, because they take healthcare access very seriously. And for example, one study showed that veterans who were African American, who had access to cardiac care, had better outcomes for certain cardiac conditions than Caucasians, because they had access to care. So it's just, extremely interesting. Why is it that the VA has these better outcomes? Better diabetes management, better mental health management, fewer suicides if you're treated in the VA, et cetera. First of all, because all the folks who work in the VA, from people who mow the lawns to people who perform brain surgery, are on salary. So there's no incentive to overtreat. We now, and I'll refer to this later, but we now have, thanks to Congress, thanks to Donald Trump, and thanks for the Democrats who voted for this program, we now have a system set up by something called the VA Mission Act of 2018, which set up a parallel private sector healthcare system for veterans who are eligible for VA care. And remember, it's not everybody. So there's about 9 million folks enrolled in the VA because they have the right discharge status from the military, have a proven service-connected disability, and or are poor or low income. So these folks can now go to private sector care under certain conditions. So we have what is quite interesting, Congress set up unintentionally a gold standard, random controlled trial, set up the conditions for gold standard random controlled trials testing VA care against private sector care, because many veterans are now going to private sector care and we have data about their treatment. And what we have shown is that in this apples to apples comparison, veterans get better care from the VA for a range of conditions, everything, like I said, from diabetes to emergency room care to oncology care to orthopedic care. And one of the reasons why they do better in the VA is because there's no incentive to overtreat. So, for example, one recent study showed that if veterans go to private sector care for prostate cancer, for low-risk prostate cancer. So low-risk prostate cancer means you're much more likely to die of old age or get hit by a bus than to die of prostate cancer. You will get the standard of care in the VA, which is watchful waiting, surveillance, rather than a radical prostatectomy or radiation treatment that could leave you impotent, incompetent, have bowel problems, or die. You're more likely, 64% more likely to get invasive treatment when you just need to be watchfully surveyed. In the VA, you're more likely to get radical, unnecessary treatment in the private sector. That's a patient safety problem. You never want to treat something aggressively that you don't need to treat, because there's side effects to all of this. So in the VA, everybody works on salary. It's not fee for service. There's no incentive to overtreat. Orthopedics is the same thing. Another study just showed that if a vet goes to the private sector for, knee, shoulder, hip pain, etc., they're way more likely to get a knee replacement, hip replacement, or shoulder replacement when they don't need it than to get physical therapy. Why? Guess why? Because it's not because it benefits the veteran, it's because it benefits the bank account of the private sector provider, whether it's a large health system or an individual, etc. So another reason why the VA has better health outcomes is because they have lifetime responsibility for patients. So there's way more incentive to do preventive care and health maintenance. Think about it. Most of us cycle in or out of a health system or medical treatment system in the US, every insurer every 10 years, right? We're constantly moving around. So why should United Healthcare pay for me to get preventive services, serious preventative services? And by that, I don't mean screening. Screening are not really, high-level prevention. They just show you disease. They don't prevent it. I mean, because preventive services and health maintenance services, which are labor intensive, pay off over decades. But if you're not going to be in United Healthcare or Kaiser or wherever, or Columbia HCA in 20 years, why should they pay for these services for you 20 years earlier if they're not going to reap the benefit? The VA reaps the benefit because these patients are in the service from discharge to grave. So there's real value to having stability, a predictable patient population, an understanding of the needs of that patient population, and a system that's coordinated to take care of them. And I believe that this model of care is something we should all benefit from, not just a small part of the population. And let me point out another thing that the VA does, which is critical. The VA is the only health system in the country that negotiates pharmaceutical prices with big pharma. So the drugs that they get are tested well tested. There's a formulary that makes sure that these are, the right drugs to the right people, and they negotiate the price. So they get better pricing. And that's one of the reasons why Big Pharma hates the VA, right? Because they don't want to negotiate with anybody. So you see the advantages of the VA, which is a nationally integrated health system, providing all kinds of benefits that we just don't get in the private sector. It's mission driven. People are on salary. It's just an entirely different set of imperatives that drives how the VA works. Does the VA make mistakes? Are there problems? Yes, of course. And another advantage of the VA is that we actually know about these problems because the VA is accountable and transparent. The VA is a government agency. It is overseen by Congress, which does a really bad job because so many folks now are on the payroll of the privatizers. It has a VA Office of the Inspector General that oversees them and scrutinizes them. The Government Accountability Office oversees and scrutinizes them. The media, the veteran service organizations. So whenever you hear about a problem, whenever the VA has a problem, even a tiny little hiccup, there's going to be a report about it. The media is going to jump on it. Congress is going to have a hearing about it. And the same problem in the private sector, nobody will ever know about. I mean, it's, if Johnny doesn't get his PT in time, mom and dad can go to their congressman and they can do a congressional investigation. If I can't get PT for 5 months because they're saving their slots for private insurance patients, not Medicare patients, and I go to my congressman, they would just laugh me off the phone, right? They have no control over the private sector except under certain limited in certain limited ways. And we can't even learn from the problems in the private sector because when a problem arises and there's a patient safety problem, and the only remedy is to sue, and that's really hard to do. And if you sue, often if it doesn't go to court, you have to sign a non-disclosure agreement, and nobody ever learns from those mistakes. And one of the ways people learn and improve is by making mistakes and learning from them. And you can't learn from many of the mistakes in the private sector because they're hidden. So we have also a very transparent system. We saw the advantages of this system in the pandemic. And it's worth, taking a few minutes to look at what happened during the pandemic. When the pandemic happened, literally the minute it became clear that we were dealing with a pandemic that was communicable, we didn't know really that much about how, the VA canceled all elective procedures and all in-person appointments. And so you could have a VA, the VA hospital at Durham, everything is canceled that isn't an emergency. While across the street at Duke Hospital, they're still having in-person appointments and doing elective procedures, and it takes them far longer to be safe. Why? Because at Duke, it's fee for service, and patient safety and population health are revenue threatening. In the VA, which has a global budget, those decisions are revenue neutral. In the VA, the docs are on salary, so you can take an orthopedic surgeon who's no longer doing total knees because they canceled those, and tell him he's going to do COVID testing. And he'll do COVID testing. And often he'll volunteer to do COVID testing because he's mission driven, right? Even though at the same hospital at a private sector hospital across the street, he would not be able to do that or even volunteer to do it because he would be working in a fee-for-service system, or she. So they immediately canceled deployment. because the VA is a leader in telehealth, and before the pandemic was already using telehealth routinely, many appointments were rescheduled to telehealth. All the ICUs were, except for, veterans who had really serious need for intensive care, were dedicated to receive civilian sector patients. And this wasn't necessary in many areas of the country, but in New York, New Jersey, Louisiana, and hotspots, civilian sector patients who couldn't get into an ICU that was overwhelmed by non-VA patients were welcomed into VA ICUs. And nursing homes, every VA has, large VA medical center runs a nursing home. There were no COVID outbreaks in the nursing homes. Why? Because they pay good benefits, they pay good salaries, they do training, and they have more nurses in their nursing homes. And they don't have churn. So you weren't having these poorly paid nursing home workers who work 4 jobs, bringing COVID, spreading COVID around from nursing home to nursing home. In fact, in North Carolina and Louisiana and Oklahoma, I believe it was, VA veterans homes, these are state veterans homes, they're not run by the VA, asked the VA to take over the state veteran homes that were run by private sector, administrated by private sector companies, and they had terrible COVID outbreaks, and the VA came in and tried to clean it up. In the COVID epidemic, and this is very important for those of us who are interested in health equity, there were no more deaths of people of color than of Caucasians in the VA system because of access to care. They had the same access to care, the same kind of treatment, and you didn't see the disparities in deaths that you saw in the private sector. I mean, this is what happens when you have a mission-driven national system. We see the VA advantage in emergency room care. There was a recent study published in the British Medical Journal and also by the National Bureau of Economic Research, where they looked at 500,000 ambulance rides for what are called dual eligible veterans, who are veterans who have Medicare and VA, so they could go to a private sector hospital or the VA. The ambulances randomly took them to private sector hospitals or the VA. After 28 days, twice as many veterans who were seen in private sector hospitals died. Twice as many as in the VA, because they didn't have coordinated care, and it was 21% more expensive in the private sector for the number of fatalities. I mean, we were paying them essentially for deaths, unnecessary deaths. And the authors of the article called this the VA advantage, and this mortality advantage lasted for the entire year. Why do they have that advantage? Because care is coordinated in the VA. You go into the ER, you're immediately called by a nurse, your primary care provider is immediately informed, you're immediately followed up by a whole team. They get you everything you need, and they follow you up seamlessly in a system, unlike going to the emergency room in the private sector, where, who knows if your provider is going to know about that or coordinate the information. I mean, I recently had cataract surgery. I had to tell my provider about the cataract surgery, because there's no shared record. I mean, it's, one could, I watched this, I read this ER study, and I'm thinking, why can't I go to a VA ER if I have an emergency? I mean, why is the system not available to all of us, right? And why don't we all know about this? I talked about the advantage of the VA in terms of prostate cancer. Again, these researchers who did this study about prostate cancer noted that the VA is the only healthcare system in the country that has adopted as a standard of care watchful waiting for low risk prostate cancer. I mean, why is this not available to everyone? Oncology care. When you start sending veterans to private sector oncologists, they start not only receiving unnecessary treatment, but the cost is higher. Why? Because oncologists are allowed in our healthcare system to mark up chemo drugs between 116 and 600%. You know, they're making a profit, these doctors, on not only treating you, but on the drugs they give you. I mean, it's just extraordinary, you know, and mind-boggling. So you have this system which has all these advantages. Now, if I were serious about healthcare in the United States, if I were a serious healthcare reformer, if I were a serious legislator, if I were a serious advocate, I would say, wow, this is kind of amazing. We have what's called a positive deviant, somebody that does it right. Why don't we learn from them? Why don't we, you know, finance the system adequately? Why don't we even start expanding it? Why don't we expand it to all veterans instead of just veterans who got an honorable discharge or who, you know, have a proven service-connected disability or a low income? Why don't we expand it to all veterans? Why don't we expand it to their families? Why don't we expand it to, you know, the dependents of veterans? And why don't we learn from it and learn from the lessons and adopt them in a broader healthcare system that it is admittedly broken and burning out providers and harming patients on a daily basis? Wouldn't that be what we would do? No. What we are doing now is privatizing the system. Instead of expanding it and improving it, we're trying to dismantle it. It's not me, but Congress has passed a series of laws at the behest of the ideologically driven Koch brothers, or now it's Koch brother, that has funded a group called Concerned Veterans for America, a hard right group that wants to privatize the VA as well as everything else. And the hospital industry, which wants to get a hold of VA dollars, and the pharmaceutical industry, which hates VA price negotiations. So you have a constellation of ideologically driven, conservative, well, really fascist donors, dark money folks, the hospital industry, and, you know, the pharmaceutical medical equipment industry. And they want to get their hands on this pot of gold, which is, you know, the 80 billion, whatever it is, per, you know, amount of money that goes to the provision of public health care to veterans. And they want to put it into the pockets of the private sector. And they have been very successful at doing that. They started doing this in 2014 with the VA Choice Act. I'm not going to go into the history of that. It's very complicated. I wrote, it's all in my book, Our Veterans. And if you go to the Veterans Healthcare Policy Institute website, it's also there. I'm a co-founder and senior policy analyst at VHPI. And we've written a lot about privatization, but essentially the effort to privatize the VA started in 2014 with what was supposed to be a temporary program that allowed veterans under certain very limited conditions to seek private sector care, following a much sensationalized by the Koch brothers scandal in a couple of VA medical centers in Phoenix and the Southwest that was really blown way out of proportion, but existed, but was blown way out of proportion. And the VA Choice Act was supposed to last for 3 years and then end, and it was supposed to provide some money for the VA to hire more staff so there wouldn't be delays in appointments for veterans. The VA needed 21 billion. It got 6, and then John McCain, who sponsored the act with Bernie Sanders, turned around and basically told Bernie Sanders, oh, I didn't really mean it. I didn't want this to be temporary. And they then created under Trump another law called the VA Mission Act of 2018, which further privatized and outsourced VA care to the private sector by implementing standards for eligibility to private sector care that are completely ridiculous. If you can't get an appointment for mental health or primary care within 20 days, or have to drive more than 30 miles for this care, or you can't get an appointment for specialty care in 28 days, or drive 60 minutes, you can go to the private sector. And this law was passed tragically by an overwhelming majority of Democrats as well as Republicans, and supported by veteran service organizations that should have known better. And so what we have now is the VA is running a parallel system of private sector care paid for by the taxpayer, and about 30% of taxpayer dollars of the clinical care budget that should be going to in-house care is going to support private sector care, on the promise and assurance that veterans will get more timely care, more conveniently located, that is of high quality. We just, after 5 years of outsourcing, so the program was the Veterans Community Care Program, it's called, is the euphemism for the privatization program, has been operating for 5 years. The VA is now facing massive budget deficits because so much money is going to the private sector, and it's just uncontrolled, right? They can essentially go, because if you live in a rural area, any vet who lives in a rural area, and about 25% of veterans live in rural areas, any vet in a rural area is going to have to drive more than an hour for care, and often way more. So they go to these private sector providers, and they'll sometimes travel farther to go to the private sector provider than the VA. So we have now 30% of VA dollars that could go to in-house care are going to the private sector, something like 36 billion. And we don't even actually know how much is going, because private sector care is increasing by 17% a year. They're poaching from VA medical center budgets to pay for the private sector care. So we have a $36 billion pot, and that isn't proving that's dedicated in each budget, fiscal year budget, or it's 36 billion. It was in 2024. It was 31 in 2023, but that's not enough, because there's no way to predict who's going to be sent to the private sector under these crazy eligibility rules. And so basically, the VA is beginning to collapse. It's having huge budget deficits. The undersecretary for the VA has, for the healthcare system, has announced that to all VA facilities that they have to have neutral hiring. They can't hire more doctors, nurses, whatever, when people leave. And they just commissioned the situation has become so dire. We've been warning about this. The Veterans Healthcare Policy Institute, my colleagues and I have been warning about this since they began debating the Mission Act. We said this is going to cripple the VA. You're going to, the classic privatization strategy is you defraud the public system of funds, and then there's delays, there's an erosion of services, and then the solution is more privatization, and then you end up killing the system. The privatizers in Congress promised that that would never happen, that you could maintain a robust VA with all its huge panoply of services and programs and facilities. That would never happen. You'd never hurt the VA. But now the VA is really passing a tipping point, and the VA recently commissioned what's called a red team. This is a term for the military, get on it, study it, give solutions immediately for a very serious, urgent problem. And the red team was made up of 6 of the nation's foremost experts in military and veteran healthcare. It was led by someone called Kenneth W. Kaiser, who was the Undersecretary for Health at the VA under Clinton, who transformed the VA healthcare system from a primarily inpatient system that delivered care of spotty quality to the system that we have today, which is the most successful and only, in my view, healthcare system in the country. He chaired this red team. There were other people on it who were experts in military healthcare. The military has privatized its own health system and is now reversing that privatization. And that tells you something when the DOV stops privatizing, and starts caring about, like, whoops, we made a mistake. They don't do that very often. So this red team was commissioned by the VA to independently study the cost and consequences of outsourcing to the Veterans Community Care Program. And they found that outsourcing has not produced more timely care. Delays in the private sector are much greater and more prevalent than delays in getting care at the VA. That's probably no surprise to many of us who are listening and who can't get an appointment in the private sector. My husband tried to get an appointment with a pulmonologist for a serious problem. The appointment was 5 months in the future, and then the 5 months, 2 weeks before the 5-month appointment, he finds out that the pulmonologist just left the practice. Whoops, we're trying to find somebody else, and now he can get an appointment in October. I mean, it's like a joke. It would be like the American healthcare would be like a Saturday Night Live skit if it weren't so tragic. So we have what the red team found in its report, which I have written extensively about, is that the private sector program is giving people care with way greater delays than the VA. The care is of poor quality, or it's impossible to tell what kind of quality is because they're not obliged to report quality metrics, and it's hugely expensive. And the VA is really on the road to collapse. So the red team also points to many solutions to the problem. And one of the solutions, of course, that it doesn't point to is really why I'm talking to folks today. It's really important for all of us to care about the fact that the nation's largest, only socialized medicine, single payer-ish system in the country is being threatened by the same forces that are threatening healthcare reform, public schools, the public provision of everything. And they're the same folks who are trying to destroy the VA and steal public money for private profit are the same people who are involved in trying to transform Medicare, traditional Medicare, into a profit-making scheme for insurance companies and hospitals. It's the same, it's United Healthcare, it's the hospital industry. They're all conspiring. They're not conspiring. They're open. Conspiracy is hidden. They're very clear. They want public money to finance private profit. And I think that healthcare reform advocates, like the folks who hopefully are listening to this presentation, should understand why the VA is great, should think about the VA as a model for all Americans, and should really fight VA privatization. So anytime you go to talk to your congressperson about healthcare reform, you should be talking about stopping privatization of the VA and expanding the VA and improving the VA. Now, my motto is VA for all. What do I mean by that? I don't mean that suddenly 330 million Americans descend on 170 VA medical centers. That wouldn't work. What I mean is that if we want to get to universal healthcare and to a national healthcare system, which I think all of us want, I think most of us want a system where a reform where it's not just a payment reform, but a payment and delivery reform, where we all are covered, but we all get better healthcare, not just medical treatment, right? That's probably what we all want. We adopted single payer and Medicare for all because we thought we couldn't get, a national health system. We adopted Medicare for all because we thought people were afraid of attacks on us for being, for socialized medicine. Yet here we have a socialized medical system, healthcare system around the corner, right? In every single state, in all over the country, and it works. And the reason why the folks are afraid of it is not because it doesn't work, it's because it does work. They wouldn't have to spend over $12 million a year to fund the Concerned Veterans for America attacking the VA. If it didn't work, all they'd have to do is, flick their little finger and it would collapse. They don't want a government system that works. So I think my argument to healthcare reform advocates is find out about the VA, find out why it's a good system. You have to find out about it because even if you, don't know anything about it, even if you don't, care about veterans, the right wing is using the VA as a poster child for why we shouldn't have government involvement in healthcare, government involvement of any kind in healthcare. So you have to be able to respond, to know something about VA, to rebut these arguments. Plus, I think we desperately need a healthcare system in America, a national healthcare system, not just a national payment system, but a system that pays for and provides care. And we need to know what it looks like. And there is one that is amazing. And it's like in every state, in practically every city, dotted across the American landscape, outpatient clinics and so forth. It's developed great care. And I think that we should look at VA as a model for how healthcare should be delivered. We should consider things like supporting the expansion of VA eligibility to all veterans and to their families and dependents. I mean, imagine if you had 19 million people and then you multiplied that by, let's say, 3, that's, you now have 60 million Americans or 80 million Americans, covered by a socialized medicine system that can say, if you talk to them enough, this really works. Wow, why can't my neighbors have it? Why can't my cousins have it and my in-laws have it? It works for me. And then, for the rest of America, we can promote the kind of models of care which, when well-financed and staffed, can really deliver such stellar healthcare outcomes. Yes, veteran patients are different than the average patient in an American healthcare practice or medical practice, right? But they're different in quality, not kind, right? In degree, not kind. I mean, yes, veterans have more musculoskeletal problems. They have more chronic diseases, but they have more, it's more, but you can apply the same techniques to Americans who have other chronic diseases. I mean, we have a population that is plagued with obesity, with diabetes, with many kind of chronic conditions. And with mental health problems and so forth. And the models that the VA has developed of integrated coordinated care would apply to them. So I hope that the folks who are listening to this talk will consider learning more about the VA, advocating for the VA, even if they've never met a veteran, even if they don't like veterans, even if they don't like the military. You know, a lot of folks who are advocates for Medicare for all or healthcare reform are, like me, not fond of the huge and ridiculous investment that this nation places in military spending. We'd like to see less of it. But the fact that the VA covers military veterans does not mean that the VA supports militarism, or that many of these veterans even support militarism. So I really hope that folks listening to this talk will think about finding out more about VA healthcare, how it is a model, how it could be used as a model for how we set up a different delivery system. And we'll also advocate against the kind of privatization that is threatening a jewel in American healthcare that we could all learn from and that we all now benefit from, even though we often don't know it. So I want to thank you for letting me spend some time with you. And I hope that we can share the website of the Veterans Healthcare Policy Institute that has a lot of information on it. I have a website, SuzanneGordon.com, which you can learn about my work too from. And I'd be glad to respond to any email questions or anyone who wants to reach out to me to find out more about these issues. So thank you so much.
Thank you so much, Suzanne.